school to become a nurse, an RN, that I wanted to teach, and that is what I wanted to do. So nurse practitioners can teach, but nurse educators cannot be nurse practitioners. That license, they're not equal in that sense. So, but I knew I wanted to teach. So I went back to school for another 2 years to get my MSN, Master's of Science in Nursing, and it was nurse educator focused. And so I've been at Nebraska Methodist College for the last almost 9 years, and also in my spare time, I work at the dialysis clinic. I love those patients. As much as I don't see them when I walk in, they're happy to see me. I love dialysis in that I provide a care. It helps their quality of life, and then they get to leave. And so I feel like I'm making a difference to those patients in that they're squeaky clean when they leave us. What else do I love the patients. I love the keeping my skills. I think it makes me more credible with students to say that I'm not just telling you in a classroom what to do, but I'm actually doing it in the field. And then also, my daughter's really expensive, so the extra money's great. Just saying. All right. It's true. Olivia can attest. So what else do I have here? I have a glow germ light. So there's the lotion if you want to see how dirty your hands are. Hand washing is the most important thing. It's not about giving an injection, it's not about putting that NG down, but everything has to be, your hands have to be clean. Hand washing. What?
Worksheets?
Yeah, I gave you an assignment. So I have the glow light. What else? Oh, I want to talk about this. This is my least favorite. So with every job, there comes things that you don't like, right? You don't like being a student because you have to do homework and take tests, right? Well, this is my little makeshift. Hopefully it doesn't pop out with the rest of it. This is an ostomy. Okay, so if somebody has a bowel obstruction or has some sort of GI problem that they can't fix, this could be a temporary or it could be permanent, where the surgeon will go in and bring part of the bowel, which is what this is, bring part of the bowel outside of the body, and then the stool comes out of here. Okay, so in long-term care, again, my least favorite, and trachs. I had a patient that he thought it was funny with his trach that if he got mad at you or he wanted to joke around, so it was a good and a bad, you know, he was feeling good or bad, he would cough and make sputum shoot out at you. Not cool. Not cool at all. Kind of gross, okay? But he thought he was funny. And occasionally, if we were having a good day, we thought it was funny. But never, if you have somebody in front of you with a trach, don't stand in front of them. Stand to the side. Just saying. Okay. So anyway, so this is an ostomy. Okay, it's the pink part. This is the bowel, comes out. And then what we do is we will cut wafers, and I did bring some wafers, but I don't know that we're going to have time to play with those. To cut it, to position it, we teach patients. So another big part of nursing is teaching your patients. We can only be with them for so long. And so you become teachers when you're a nurse as well, and that's a critical piece to every patient care, okay? How they take care of themselves when you're not at their side. So these wafers come, there's all different kinds of products. They will cut these to fit because we don't want the stool to get on the good skin around it, and then they'll have a bag that locks, okay, in place, and that's what will collect the stool. They change them, they burp them, because, you know, just like people have gas, these will have gas as well. So any other, I'm kind of just moving on from this because it's really not a fun topic to talk about. Okay, here's another, this is a child colostomy. So as you can see, that one was a little bit bigger. That would be more an adult size. Here's a little kiddo one. All right, kind of sad. I mean, if you think about, stop. If you think about what, the size of kids, everything's smaller with the kids. This one is kind of cool, and I've actually seen this in long-term care. This is a stage 4 pressure ulcer. Okay. Now we don't just walk around with these things. We have high fidelity mannequins at the college. We have these simulation rooms that are really awesome. And so we can put these on our high fidelity mannequins and put a dressing over it, and it really does look real, okay? But what do you think this white thing is here? What is it? Bone. Okay, stage 4 is that deep that there's bone exposed. Can you imagine how painful that is for somebody to endure? People will come in from home, okay? We don't make these. People will come in from home and they have waited so long that they can't stand it any longer, okay? People who are malnourished, who are obese, diabetic, these are the individuals that will suffer from these. Immobile, okay? I have some other surgical site infections, so I'll just hold them up. You can see your goal is for pink, nice pink tissue. If you see that there's not like the yellow slough, eschar, I don't think I have any eschar. Eschar would be black, okay? So those are some things that if we have time, you can come up and look at. Other things that we give are injections. And this is one class that we have at the college for the nursing students. It's the whole class. It's like 5 hours of how to give injections. So the course that I teach in, we start with oral meds, injections, topical medications. They don't start IVs yet. That's when they move on further from us. But we can do things such as reconstitute. So as a nurse, you might not have the pharmacist be able to do everything for you. So the powder, when I'm at the dialysis clinic, I'll pull some antibiotics out of the cabinet and I have to reconstitute. And that means adding sterile water to it to make the correct solution, the strength, and then I draw up however many milligrams that I need. Okay, so that's one thing. Another thing is we'll use ampules. Certain medications come in ampules, and this is a glass vial. Okay. What kinds of questions do you have? I feel like I'm just rambling on. Any questions so far? So we talked about hand washing. I brought some gloves. I was going to do sterile gloving. One thing that our students really struggle with a lot is how to keeping dirty, clean, and sterile separate. And as a nurse, that's super important because if I put gloves on and I'm starting to do a procedure, it's also kind of fun when you first start wearing gloves because you're not used to them, so everything you feel like the butterfingers. But I've watched people, and I've done this, and then I'm like, first of all, I should have used hand sanitizer before I put these on. But I'm going to do something to my dear daughter here. And then I'm like, oh, wait a minute, and I go and touch the trash can. Is that good? No. Because now my clean has become dirty. So I take my gloves off, wash my hands, put new ones on, right? So then I've seen people, so let's pretend these are sterile gloves. And you guys can practice this too. I have fake gloves. So I have these sterile gloves and they're in a package. And so see how I cupped them? So I can't touch, they're on a sterile paper. I can't touch the outside because that's what I'm going to be touching, whatever's sterile, right? So I can only touch the cuff, and then I scoop on in here. But let's say I do this, and I'm like, oh my gosh. Can I touch this now? I can because this is all sterile and this is sterile. So I can conveniently switch them around, and now I'm sterile. Can I touch Teresa's glass? No. Can I scratch my eye? No.